You're listening to BFM 89.9, the business station.
According to the Ministry of Health, last year marked the highest number of new organ pledges in the country, with 29,500 people registering with the National Transplant Resource Centre. However, the ministry says this is still insufficient to address the nation's shortage in organ supply. Today on Current Affairs, Kathleen Tan speaks to Dato Dr. Zaki Morad, Chairman of the Board of Directors at the National Kidney Foundation and consultant nephrologist on this issue.
Experts say that the crux of the issue or the organ supply crisis in Malaysia lies with the limited number of organ donors in the country. Statistics show that less than 1% of Malaysians are registering as organ donors out of a population of 27 million. What are some of the main reasons why only less than 1% of Malaysians are registering as organ donors?
One of the reasons is perhaps awareness. Although the level has increased over the last 10, 20 years, many Malaysians may still not be aware that about organ donation and its role in treating patients with organ failure states. Secondly, we have problems in the sense that someone who pledges an organ, if it turns out that he dies and organs need to be removed from him, some family members may object, and doctors will normally do not force the issue, even if they know that the person has signed a pledger's card, So you see, these are some of the reasons why we find there's not that many organ pledges in the country.
One of the reasons why there are not many organ donors is also religion. Are religious concerns about organ donation valid, or are they mostly misconceptions?
Well, there are most likely misconceptions. Actually, all the major religions in the world support organ transplantation. Islam, Christianity, Buddhism, Confucianism, they all have stated very clearly the fact that donating an organ is a good deed. It helps to save mankind. And in fact, Islam as early as 1952, or in this country as early as 1970, have pronounced in a fatwa that it is permissible to donate organs. So I think it's mainly a misconception by the people, or sometimes people use religion when they don't want to do things as an excuse. Yeah.
To what extent is the organ supply crisis caused by the organ procurement process in Malaysia?
Well, the organ procurement process can be quite complex, but I do not think that it is a major hindrance to organ donation. Actually, once a person has signed a card to say that he wants to be an organ donor, and if he dies in the right situation, that means he dies in an intensive care unit of a hospital, the process that follows will be for the doctors to confirm that he has pledged to give his organs, to consult with his family members. They may have time about 24 hours or 48 hours to consult with their family members. And if they have no objection on the family members, the rest of the process will be more of a technical and medical in nature, ensuring that we keep the blood pressure up until we can remove the organs and so on. So I don't think the process is a very difficult one.
One of the proposals to address this organ supply crisis is for Malaysia to resort to an opt-out law option, which is practiced in countries such as Singapore and in Europe, where donation of the organ is compulsory unless indicated otherwise. In your opinion, should this be implemented in Malaysia, and why hasn't it been implemented, given the supply shortage?
Yes, there's been quite a bit of a debate among the doctors and other interested parties on what kind of law we should have in this country. In my personal view, I don't think we're ready to have such a law. As you know, in this law, or at least as practiced in Singapore or some other countries, once you reach the age of 21, you have to declare whether you want to be an organ donor or do not want to be an organ donor. If you fail to do so, you're automatically assumed to be an organ donor. And in a way, the state has a right to remove your organs when you die. If you look at the environment in this country, number one, some people perceive this type of law as a bit of a coercion in a way, and that may not be fair because there's no element of voluntarism in giving these organs. That's one. Secondly, if you look at the logistics of the country, sometimes people may not get letters from the government or letters or us requesting them to indicate their preference to be or not to be an organ donor. And thirdly, also I think for many of the people, the level of functional literacy in this type of niche areas, such as the organ donation, can be quite low. So when someone gets a letter, he may not understand what it's all about and just ignore it. So that could be also a problem. So it's just not just the law, it is also a lot of other issues that have to be addressed before we are ready to have the law.
Now, referring to cadaveric transplants in Malaysia, experts have pointed out that the organ pledgers, and as you have mentioned earlier, despite having registered and given a pledge card, are not necessarily an organ donor, as the pledger's organs cannot be removed without the family's consent. Do you see this as a major problem to addressing this organ supply, and what do you see as a way of overcoming this problem?
Well, I don't think that is a major problem, and we can always look at it in a positive way. Once a person, we have now been encouraging those who sign this organ pledges card to let their family members know, or their spouses, or the next of kin, and so that they are aware that they have become their family members have been aware that they have become an organ donor, organ pledges. And in a time when the time comes for us to remove the organs, their family members are prepared mentally. So the real problem that has happened in the past is because people don't talk to their family members, or they forget to talk to them.
Is the Human Tissues Act 1974 sufficient to boost the numbers of organ donation in Malaysia? Because I understand that in recent years it's come under the limelight of in needs of amendments.
Yeah, the Human Tissues Act in 1974 is rather inadequate to address the contemporary problems of organ transplantation. In fact, there's an attempt now by the government to form a group to look into aspects to propose for a new law. And the inadequacies of the Human Tissues Act are now being looked at. For instance, its consent is not very clear in the Human Tissues Act, and also pronouncements of death. For the successful organ transplantation program, we need to take organs when a person is brain dead. So this, but the public is more aware of the normal way of people being pronounced dead, the cessation of heart rate and so on. So they may not accept brain death. So we are going to put this brain death into the new law. The other aspects of the organ transplantation program, including commercialization of transplantation, were also not addressed in the Human Tissues Act. So I think with a new law, we can comprehensively address all these issues, and hopefully that will bring transplantation forward in this country.
Talking about the commercialization of organs, Malaysia has been pointed out as as a transit point for the black market of commercialization of organs. How true are these assertions from your viewpoint as a nephrologist?
Well, I think they were completely false, and these were baseless allegations. The reason being, as I mentioned, we could probably count with the fingers of our hands the number of surgeons who do kidney transplant, or even less the number of surgeons who do heart transplant or liver transplant. And you can't do this type of surgery in a small shop lot anywhere. It has to be done in a properly equipped operation theatres. So these allegations are probably not right. And so far, no one has come forward to give the proof in terms of the names of the individuals involved, the name of the hospital involved as well. So I don't think it has happened in this country.
Is the expertise of nephrologists an issue to consider here to see whether Malaysia could be participating in this black market?
Well, we normally are not involved during the surgery itself. Nephrologists are involved immediately after the surgery to look after the patients who have received a kidney transplantation. So the surgeons who put the kidney in are usually the urologists or the general surgeons. And again, as I mentioned to you, we know the few who do this type of transplantation. So it's unlikely that they will be participating in this activity.
Okay. Another option to cadaveric transplants is a live donor. One of the concerns of being a live donor is the fear of short and long-term complications of organ donation to the donor. How real are these concerns from a medical perspective?
Yeah, we're talking I'm confining myself to just kidney transplantation. The experience worldwide has been more than 60 years on kidney transplantation. And large studies have been done in a number of countries that look at long-term survival of the kidney donors. And to date, no major untoward events have happened to these kidney donors. This is on the assumption that before one kidney is removed, the doctors must have checked the patient and found that he got 2 healthy kidneys. If you have 2 healthy kidneys and one is removed for transplantation to your loved one or to someone else, then you are likely not to have any major mishaps in the future. Having said that, there have been also case reports on 1 or 2 number of cases where there have been some problems with the donor, but by and large, it's not a big issue.
Many countries have signed with the World Health Organization to say that they are against commercial transplantation. What are the dangers of commercial transplantation to the donor and perhaps the recipient as well?
Well, if you look at the history of commercial transplantation, it started off usually in countries which have a high level of poverty. And usually the poor person is being enticed to part with one of his kidneys, or even some people said one of the eyes, although I doubt about the eyes, but certainly with the kidneys, to part with the kidney, one of the kidneys, for a monetary gift. And invariably in this type of situation, there's a lot of exploitation and abuse among the poor, and there is a racket among doctors, among agents, middlemen, and so on. So it's a totally unsavory practice that WHO, the World Health Organization, and the International Transplantation Society, which is the body of transplantation experts, have condemned it and have encouraged countries to sign with the WHO, sign up with WHO to say that they are not participating in that kind of activity. And Malaysia has signed up with WHO on that.
The Organ Donation Awareness Promotion Action Committee Chairman Tan Sri Lee Lam Tai has said that as of last December, the number of actual organ donors since the organ transplant program began in 1976 was 352. Now that's less than 10 actual donors for the past 36 years. Do you think that the Organ Donation Awareness Program has not been successful?
Well, it is a long uphill task, and in a way, he's right that we may not be that successful if you compare to many other countries. For instance, Spain has got the highest rate of cadaveric organ donation in the world. Countries like many countries in Europe and USA are in the middle, and we are right at the bottom among many other countries. Of course, there are other countries that are even worse than ours. We are getting about 1 to 2 donors per million population, which is low. The reason is varied, and it may not necessarily just for the medical people to address it, for society as a whole to address issues on this,
We're speaking to Dato Dr. Zaki Morad, Chairman of the Board of Directors at the National Kidney Foundation and consultant nephrologist on addressing the organ supply crisis in Malaysia. After the news, we'll be discussing whether there should be more kidney donation awareness drives targeted at the older generation.
BFM 89.9